So great. Welcome back. There may be a few of you that weren't at lunch, so welcome again to the 15th Annual Economic Outlook. We really appreciate you all coming today. We had a great luncheon speaker. I learned some things. I talked to other people in the room, and I think they learned some things too. And I even had somebody tell me they were taking notes. So that was good. It's now my pleasure to introduce Mike Talbot. Mike is going to be the MC for the remainder of today's activities. You've seen Mike before at these events. He's a professional communicator with over 30 years of experience in public speaking, radio and television broadcasting, and government affairs. He has his own company, does this for a living, but also does commercial productions, crisis communications. I'm not sure what that is, but yes, I do know that. As his background in DOE, I can understand that, crisis communications, right? So he's a full-blooded Cougar. He's been here for 30 years in the community, so welcome, Mike Talbot. Thanks.
Well, we'll just have to work around the table clearing, I suppose, but that's not too bad because I have a good lineup, as we have had for 15 years or so. But first, before we get started, I'd like to bring Susan Creed up. Susan is the chairman of the board for Kadlec Medical Systems, or Health Systems, and Kadlec also is our presenting sponsor today. So, Susan?
Thank you, Mike. Welcome. It's indeed my great pleasure to welcome you here this afternoon for TRIDEC's 2014 Economic Outlook. TRIDEC puts together this event every year in order to present key economic indicators and issues facing the Tri-Cities area. The idea is to bring together an influential and diverse set of community leaders in order to encourage and facilitate collaboration and action toward greater economic prosperity. Kadlec's been a major sponsor of this event for several years. We see ourselves as benefiting from a robust economy in the Tri-Cities, and we believe that a robust healthcare system is attractive to both individuals and businesses looking for opportunities to locate here. The healthcare industry is also a major driver of the Tri-Cities economy. The 4 hospitals in Benton and Franklin counties, Lourdes Health Network, PMH in Prosser, Trios Health, and Kadlec Regional Medical Center, employ almost 4,500 people, and last year had a payroll of approximately $280 million. That's a lot of money staying in our community. And that's even before you add in all the ancillary services, the community providers and their practices at our local pharmacies, and all the construction work. There was a lot of that last year. We also believe in collaborative action. Kadlec has worked closely with PMH Hospital in Prosser and Walla Walla General Hospital to open 2 new clinics in Prosser. And Kadlec hospitalists have worked side by side with Prosser healthcare providers to ensure that Lower Valley patients have access to care close to home. Over the last several years, we've worked closely with Columbia Basin College to strengthen, support, and expand their health services programs. We've been delighted to welcome their students and graduates as members of our clinical care teams, and we look forward to future opportunities to collaborate with CBC. Recently, Kadlec collaborated again with Trios Health, Lourdes Health Network, PMH, Group Health, and the Lamson family to support the expansion of WSU's nursing program here in the Tri-Cities. As a result, WSU has been able to move into space built specifically for the needs of its 4-year nursing students and its graduate nursing program as well. Now we're working with the Washington State Legislature to try to expand the opportunities for graduates of Washington State medical schools by establishing a primary care residency at Kadlec sponsored by the University of Washington's Family Residency Network. The legislature's done a fine job of supporting expansion of medical education both at Pacific Northwest University in Yakima and the University of Washington in Spokane. However, there's been no increase in the number of residencies, so there's terrific competition for any available slots. Graduates from Washington State medical schools run the risk of finding themselves graduating without being able to get into the residency programs that they need in order to complete their education. Last year in the United States, approximately 500 medical school graduates were not able to get into a residency program. That number will be compounded again this year as additional medical students graduate, and it'll be compounded again as we try to educate enough physicians to meet today's needs. We know that about 2/3 of the physician residents end up practicing near the place where they train. We also know that Eastern Washington is already underserved when it comes to primary care physicians. So we're hoping to be part of the solution to that problem with just a little bit of help from the state legislature. Cadlick is also in the process of beautifying a bit of central Richland. We're remodeling the old Rite Aid Payless building that's been standing empty on Lee Boulevard for many years. When it opens later this spring, it will become the Cadlick Healthplex. The Cadlick Healthplex will house more than 20 of Cadlick's services and programs that have been scattered throughout the community. Services such as asthma education, cardiac rehabilitation, the Coumadin Clinic, the Diabetes Learning Center, genetic counseling, physical therapy, the Pulmonary Function Lab, wound care, and Cadlick Neurological Resource Center. The Healthplex includes spaces for events and meetings, education and exercise classes, a demonstration kitchen, and a health library. There'll be a warm water therapy pool, a large gymnasium, and even a walking track inside the building. The almost 100 people who will be working there will be focused on building a collaborative, multidisciplinary approach to outpatient care. It's taken 2 years to research, design, and build the Cadlick Healthplex. We all know that healthcare is changing dramatically, and the Cadlick team has created a facility that reflects the most current thinking about how to provide outpatient care effectively. We think our patients and community members will find it a great asset for maintaining their health or for regaining their health following a stay in the hospital. We're looking forward to a grand opening this spring. We hope that you will all come take a look before we get started with patients. Now, to be a little bit corny, I also think you'll find the information presented here this afternoon will help all of us maintain and improve the economic health of the Tri-Cities and surrounding area. And again, on behalf of Cadlick, I want to welcome you to this year's TriDec Economic Outlook.